think of a form of medical treatment that does not involve needles or syringes or intravenous fluids or even medications, but with just an intense body massage, inhaling essential oils, and even meditation, your well-being is improved. Think about that. Hello, beautiful saints. Welcome to another exciting episode of Catholic Faith Forum. I'm Evelyn, and on today's episode, we shall be discussing complementary therapy. With me is an amazing guest I cannot wait to introduce till we return from this break. Stay with us.
Complementary therapy refers to the practices that are used alongside conventional medical treatments to promote healing and well-being. These practices often include prayer, anointing with oil, and seeking spiritual guidance from religious leaders. James chapter 5, 14 to 15 says, "Is anyone among you sick? Let them call the elders of the church to pray for them and anoint them with the oil in the name of the Lord. And prayer offered in faith will make the sick well. The Lord will raise them up. If any one of you have sinned, you will be forgiven." Complementary therapy in this context is seen as a way to align to God's will for health and healing, recognizing the importance of both faith and medicine in the restoration of health.
Welcome back, Saints. If you're a first-time viewer, this is Catholic Faith Forum. I am Evelyn, and on today's episode, we shall be answering the question, is complementary therapy holistic? Allow me to introduce to you my very special guest in person of Dr. Isikalu Oluwatosin. You're very much welcome, sir. Thank you for honoring our invitation.
It's a pleasure to be here. Thanks for having me.
We can't wait to get enlightened on complementary therapy. You know, even with the introduction, so people already and I'm already anticipating actually. All right, how are you feeling today?
I'm good.
You look really smart.
Well, hopefully what I say is in congruence with what I look like.
Oh. Dr. Isikalu Oluwatosin is a critical care doctor at Lagoon Hospitals. He has a keen interest in seeing people get over pain. And when he's not saving lives at work, he's given to enjoying music and poetry. That's amazing. Poetry. How about this poetry? How long have you been on it?
Oh, well, it's been a while. Major interest is spoken word poetry.
Ooh, wow.
My interest was first picked when I saw some American faith-based spoken word poets, the likes of Jackie Hill, Janetics,
Ooh, yeah.
Preston Perry. Yeah, so that was when my interest in enjoying that form of art was first. And since then, it's been nice to follow.
That's cool. That's really cool. So let's not digress. Let's get to it. So what is complementary therapy?
All right. So complementary therapy is when we say complementary therapy, we refer to other forms of medicine aside conventional medicine. Conventional medicine in this sense is the normal medicine that we know.
Yeah.
Hospital, you go, you get checked, investigations done, the diagnosis is made, and treatment. Complementary medicine refers to other forms of medicine that can be used alongside conventional medicine.
Wow.
However, it is important that this definition there's some context. We add some context to it because depending on the environment. So for instance, if you are in the Western world, what they refer to as traditional medicine is what we call conventional medicine. Do you understand? So conventional medicine, for us here, you go to the hospital, get treatment. In certain parts of the world, that is traditional. That's what you call traditional medicine. But here, when you say traditional medicine, is another form. Exactly. But in the context of the Nigerian setting, or let's just put in general terms, complementary medicine or complementary therapy is forms of medicine, forms of treatment that can be used alongside, for the purpose of this discussion, conventional medicine.
All right, talking about forms, what are these various forms of, complementary therapy?
All right, so the forms of complementary therapy there are different categories that they fall into. I must also mention that in some places in some another contextual situation,
Yes.
complementary medicine can also be referred to as alternative medicine.
Okay. Alternative medicine.
So, but the forms that they exist in, so we have the forms where where that involve energy therapy. So
Okay.
energy therapy, this is more common in the Asians.
Okay.
So you have Tai Chi, people are given to Kung Fu,
Okay.
So it involves you using a level of training that helps you to channel your energy towards certain towards certain channels or through certain channels.
Mental energy?
Yes, mental energy as well. So that's one form of it.
Okay.
Another one is the involves the body or manipulation of the body, which is quite common. So this is where massages come under.
Okay.
So it involves having massage. Your body is stimulated in a certain way that helps you feel relaxed, feel better, release tension. So that's another form.
Yes.
Another form of this is what we call the biological based therapy. So this one, in this form, this is more common in our environment because we use a lot of herbs.
Yes.
Yeah, so you have the use of herbs, biological based, so no synthetic forms of medication at all. So you have drugs that are taken straight from their natural essence, and you use them in that form. So that's another category for complementary therapy that can fall that you have examples on that, and they have their uses. Another form is acupuncture. So with acupuncture, basically what this entails is that or it follows the philosophy that our body have certain sensitive spots that if when stimulated or understimulated can release certain chemical substances in our body that can have an eventual effect in relieving pain, in relaxing us, and so on and so forth. So these are just a brief summary of some of the more common ones that we can find.
Wow, awesome. Let's take a break and find out who the saint of the week is. We'll be right back.
Our saint of the week is Saint Francis Solano. Saint Francis Solano was born in 1549 in Andalusia, Spain. Showed early devotion to God, studying with the Jesuit priest, joining the Franciscan observance in 1569. Ordained a priest in 1576, he exhibited zeal and charity, dedicating himself to preaching and ministering to the afflicted, notably during the plague of 1583 in Granada, where he fell ill but quickly recovered. Sent to Peru as a missionary, he displayed extraordinary compassion when his ship ran aground, refusing to abandon enslaved Africans whom he had comforted and baptized amidst the wreckage. Despite the perilous situation, he remained steadfast, eventually reaching Lima, where he embarked on 20 years of tireless ministry amongst indigenous people and Spanish colonists. Renowned for his gift of tongues and numerous miracles, he was affectionately called Wonder Worker of the New World. His devotion to Our Lady, expressed through music and prayer, echoed the piety of his namesake, St. Francis of Assisi. He passed away on July the 14th, 1610, and was canonized in 1726. And St. Francis Solano's feast day is celebrated on July the 13th, honoring his remarkable life of faith and service. St. Francis Solana, pray for us.
Welcome back, Saints. If you're joining us for the first time, our discussion is still centered on complementary therapy. So we are answering the question, is complementary therapy holistic? Just before the break, I was going to ask you that, talking about biological therapy and the use of drugs right from their sources, from their essence, would someone not confuse it with traditional medicine?
Yes, so that can happen. So that again, I go back to what I said at the beginning in terms of the context of what you are describing. So, for instance, in certain environment,
Yeah.
that biological therapy is seen as strictly complementary therapy.
Okay.
In the African context,
Yes.
when you say biological therapy, you automatically think traditional therapy.
Yeah.
But essentially, simply put, they can be intertwined, or they basically mean the same thing, or at the root of its practice,
Yes.
they are quite similar.
Okay.
Because the traditional medicine or the person who does herbal medicine,
Yeah.
at the nitty-gritty of its practice, is that they believe essentially in taking products of the earth,
Okay.
things that have been naturally produced, or
Yeah.
things that they cultivate from the ground, natural products like that can be used naturally without too much manipulation or too much
Okay.
processing to get the benefits of it.
Wow.
Very common, the dongoyaro leaf or dongoyaro tree
Yes,
has
that's
over
true.
time been shown to be very effective in managing malaria.
True, very true.
So, and this has been years upon years upon years. I'm
Yes.
certain that there are places in Nigeria today where if a child falls sick, that will probably be their first point of call.
Yes.
Exactly.
Yeah.
So, but they are quite similar in the practice, or let me go back, in the nitty-gritty, or in the crux of their essence, in that
Okay.
both of them believe that we can extract natural products or naturally occurring plants, essences that can be used to give healing and health to the body.
Wow. So when I was doing my research, I saw that the use of essential oils is also some form of complementary therapy.
Yes.
But on average Nigerian, to just inhale oil that has some scent with it, I don't know.
Well, so that's it. It's when you get exposed to something,
Yes.
your knowledge about it, or when you experience something, you have a different outlook on it. For instance, the average Nigerian who sees inhaling essential oils as strange, if he's perhaps, let's say, he's asthmatic and he comes to the hospital, he will be given something to inhale too.
Yeah, that's true.
So, so there are different forms, there are different ways that, even it's not just the oil. Just like the example I gave where the Asians would do Tai Chi as a form of healing.
Yes.
To the Nigerian, that would be weird because it's not something that his culture is used to.
Yes.
Or even massage. If I asked if you took a run, when last did you get a massage?
I've never got it.
Exactly. But in some climes, it's a regular thing for certain people.
True.
So yes, some they work. But like I said earlier on at the beginning, that I may be a bit biased because I'm on the conventional side of medicine.
Okay.
For all these other forms are seen as from the main, as simple as the word comes from, complementary. They are not meant to replace, or we believe as practitioners of conventional medicine, that in as much as you use these complementary forms of medicines, they should not replace, conventional medicine itself.
All right. So I would like to know, what are those certain medical conditions that complementary therapy are most effective for?
Okay, so for this question, it's quite an interesting question, because again, like I said, I'm a bit biased because I practice on the conventional side of medicine. But there is no, this is a challenge with complementary therapy. There is no, it's not written in black and white, So it's as interesting as it may sound, a complementary therapy that can work for you might not work for me.
Wow.
But if I have malaria and I give you, for instance, the common combination of artemether and lumefantrine, which we use for most people, there is a 90 to 100% chance that if you use it and I use that same drug, we will both achieve the same outcome, which is get better in 3 days. So that's a challenge with complementary therapy, such that over time, and even with scientific research, studies have been done that what works for this person might not necessarily work for this person.
Wow.
So for instance, it's common for you to find, so back to your question, to answer your question directly now, there's no direct answer,
Oh.
but it's common for you to find a lot of complementary therapy being used in patients who have cancer, for instance. It's quite common.
Wow.
But again, there's no certainty that the use of complementary therapy in this patient who has cancer will lead to cure.
Wow. Amazing. Let's take another break. It's now time for our Know Your Faith session. We'll be right back.
In a past season of the Know Your Faith series, we learned about the power of the rosary. Now, before I go on, please, if you've not watched that episode, pause this one first. Go on YouTube and search The Power of the Rosary, Dominican Media. Sit down and watch it. Because we learned in that video that through Saint Dominic and Blessed Alan de Rupé, our Blessed Mother Mary made 15 promises to those who say the rosary every day. Now, 5 of them were treated in that episode, and we'll be treating another 5 of them today. Now, so you see what I mean when I say you should pause this one first and go and watch that one. Because if you've not watched part 1, how you understand part 2? Alright guys, the first promise we'll be looking at today is that 1. The recitation of the rosary will cause virtue and good works to flourish. It will obtain for souls the abundant mercy of God. It will withdraw the hearts of men from the love of the world and its vanities, and will lift them to the desire of eternal things. Oh, that souls would sanctify themselves by this means. Basically, the devout recitation of the rosary helps us carry out good and virtuous works. That's what that promise is saying. Number 2, the soul which recommends itself to me by the recitation of the rosary shall not perish. That is being saved from eternal damnation just by recommending yourself to Mary through the rosary. 3, those who have a true devotion to the rosary shall not die without the sacrament of the church. Now, this simply means that at the point of death, a true devotee to the rosary must have received recently the sacrament of the church, especially that of penance and Holy Eucharist. 4, the faithful children of the rosary shall merit a high degree of glory in heaven. When you enter heaven, they will call you Agbabola. They will not ask you how much is money, don't worry. Money is not needed in heaven. Number 5, those who faithfully recite the rosary shall have, during their life and at their death, the light of God and the plenitude of His graces. At the moment of death, they shall participate in the merits of the saints in paradise. Now, this basically means that we will be like Saint Stephen at the point of death, seeing the heavens laid open and the Son of God sitting at the right-hand side of the Father. Guys, I can't wait. So far on the show, we've treated 10 out of the 15 promises made by the Virgin Mary to those who devoutly pray the rosary. Now, we'll be treating the final 5 promises in a future episode. Stay tuned. That's it for today, guys. Do well to like, comment, subscribe to our YouTube channel, share this video with your family and friends, and till I come your way next time, don't miss me too much. Be bold, be Catholic.
Welcome back, Saints. If you're joining us for the first time, you're not late. Our discussion is still centered on complementary therapy, and we are answering the question, is complementary therapy holistic? And just before the break, Dr. Oluwatosin was shedding more light on the fact that complementary therapy, the outcomes differed from person to person. So I was going to ask you that, is it possible for a complementary therapy to alter conventional medicine?
Yes. So in depending on what you do. So that's again, in as much as, for instance, with medicine, a lot of things cut across. Even with conventional medicine, a lot of things cut across. I mean, everybody should eat healthy. Everybody should rest well. Everybody should hydrate. There are some things that cut across for everybody. But when we begin to bring it home and begin to tailor care for each person, we find out that some things that you would need might not be the same thing that another person would need. So if you have specific requirements, health requirements, nutritional requirements, drug requirements, your what you would be able to use in your complementary therapy
Yeah.
has to be controlled as well to tailor your
Okay.
personal needs. So I mean, if someone who is suffering from some form of musculoskeletal problem,
Yeah.
and he has tried and tried over time, even with conventional medicine, that's not getting better, and the orthopedic doctor or the physiotherapist is saying is trying to manage the situation in the best way they can.
Yes.
The person who is going, when he's going to practice some form of complementary therapy, let's say massage now,
Yeah.
the masseuse or anybody who's going to be doing that for him has to put into consideration the specific requirement for that person. So it can't, there are certain maneuvers that person shouldn't do.
True.
So that you don't aggravate the situation. Certain maneuvers that you can do that would actually help the person to get better.
Wow. So I think a key factor to a person having the best outcome from complementary therapy is that anyone delivering or offering the care to that person must understand the person particularly to his or her needs.
Exactly.
Wow.
Exactly.
Wow. So talking about specific complementary therapy, are there potential side effects or, risk associated with it?
Yes, I mean, I will relate it to this question I just answered too. So if you, for instance, someone who's having, let's say, a renal problem, for instance, has issues with his kidneys over time, his kidneys have developed some problems. For such a person, what the person takes in. So let me just go back a bit. Our kidneys are essential for maintaining some form a metabolism in our body, or metabolites rather. So what you take in, a lot of what we take in is filtered by the kidneys. The kidneys determines what is going to let out and determines what is going to be retained.
Okay.
Now, so for someone who has a kidney problem, for instance, and wants to try complementary therapy, wants to try, let's say, biology-based, wants to try herbs.
Okay.
It's important. It's a tricky situation because in as much as the herb can be beneficial, you need to be certain that this herb you are taking will not further worsen the situation.
That's true.
Because the herb you are taking can be toxic to your kidney. I mean, and the interesting thing is this. Unfortunately, when you come from the side that I'm on and you talk about these things, it is easy for you to be seen as in quote, a hater because you are trying, it looks like you're talking down on trying. But I mean, for every medical practitioner knows that a lot of the drugs that we use come from the same herbal sources. But the advantage that we have, or the good thing, let me put it that way, is that these herbs have been tried and tested.
Yes.
You've taken them, they've gone through processes, they've gone through tests, they've gone through randomized trials, they've gone through, they've been through the fire and come out fine. And okay, and say, okay, if we give this person this much of this thing, this person will get better. If we give this person this little, there will be no effect. So that's where the major difference between, another major difference between conventional and complementary therapy comes in. Conventional medicine, there is an evidence-based management that has been tried over time with standardized processes, which you might not find in all forms of complementary therapy.
Wow. So just before, there's not so much time on our sides, but, we have to answer the main question of our discussion. Is complementary therapy holistic?
Okay. So is complementary therapy holistic? I'll just start by saying that I'll end by starting to say that some things cut across with conventional and complementary therapy. Some basic philosophy of medicine are seen on both sides. So the complementary therapy, that the person who practices complementary therapy and the person who practices conventional medicine believe that, the treatment of anybody who is ill, who is sick, should be a holistic approach. So if we are thinking that way, we must be open to find out that we would do the evidence-based treatment as much as we can. But if there's a benefit that the complementary therapy can add to the treatment of this person, we will be willing to try it. But get much information, get the knowledge needed. Be sure that what you're trying is going to benefit you and not further worsen the situation.
Wow. Awesome. I am enlightened beyond, beyond what I actually knew before we started this conversation. And I am confident that our viewers too have learned so much. And I just want to say thank you for sharing your wisdom with us. Thank you for sharing from your wealth of knowledge. When I told you you were looking smart, you were doubting me. Oh my God. Thank you so, so much. And that brings us to the end of our discussion, guys. Thank you for staying with us. If you have questions and contributions, we welcome everything in our comment section below. Follow us on our YouTube channel at Dominican Media. Follow us at CFF on TV on Facebook, Instagram, and Twitter. I remain Evelyn Iwoha. Until next time, keep being saints in jeans and shirts. Bye-bye.